Hello everyone, I'm Dr. Anuj Pachhel, an MBBS intern at Government Medical College Nagpur. It's been exactly 1 month and 2 weeks since I first started my internship, where I first became a doctor in a hospital, working full-time, treating patients and doing different procedures. And this is the video about the good, the bad and the ugly of being a doctor in India in 2023. This is the video that I should have watched before I gave my NEET examination, before I started my MBBS, and also during my UG periods to set my expectations correctly. Because even though on the surface it might seem like an amazing job, but there are a few times where it is not. So without any further ado, let's start. First up, part 1 is the good part, obviously. The best part about being a doctor is that all the things that you read are now being applied in real life. I'll just give you an example. Yesterday we had a case of 3 women who were brought to our casualty because of a road traffic accident in which all the 3 of them had suffered some sort of fracture or a crush injury to different parts of their body. The LTS protocol, the airway, breathing, circulation, exposure, disability, all of that, and we got the patient's heart working back. I was the one who was performing the CPR, somebody else was doing the bag and mask ventilation, another person was doing the reduction for the different fractures she had, and we actually got the patient on the ventilator and saved a life. You read all of this in textbook. I remember reading about this in Marrow notes in the trauma unit, but when I'm actually posted in a trauma unit, I'm able to do all of these things by myself. And I think that is the most distinctive feature, that's the best part about being a doctor, is that you are actually able to treat patients, and the thing that you were working so hard for all these years, you're finally able to achieve it. And it's a huge dopamine hit that makes me go to the internship, the trauma surgery posting every day. Another instance of using this knowledge in real life is that during my final year days, I loved suturing. That means टाके लगाने patient को ताकि उसका wound जो है वो approximate होके heal हो जाए. So I practiced a lot on my suturing pad, and I always imagined the moment where I would be actually given a patient in which I would do this for myself. Being practiced for almost 1 year, when I actually got the patient, I did the suturing to the best of my abilities. Even though it was not perfect, I gradually improved. And at this point, it makes me really happy that I actually practiced that before so that I could use it right now. If you're posted in a high exposure setting such as GMC Nagpur, where patients are continuously coming and your residents are good and they allow you to do certain procedures, you will be taught even complex things such as putting an ICD or doing spinal anesthesia. The third point is that you get the real doctor wali feeling while you have become a doctor. Of course, when the final year MBBS results come, you actually start calling yourself doctor. You change your Instagram handle. Guys, it's Dr. Anuj Pachhel now. But the most important feeling comes when a patient compliments you. Again, just last week I was doing a suture for a person who had a road traffic accident. He had a lacerated or some sort of an incised wound over his scalp, and I was told to suture him. Due to the proper local anesthetic infiltration and keeping the patient busy in a conversation, I was able to deliver a suture which was sort of painless for him and also provided great approximation. All during that time he chatted with me about his family, his life, what he does for a living and all of that. And at the end, he actually complimented me by saying कि तुम बहुत अच्छे डॉक्टर हो और तुम्हारा हाथ बहुत साफ है. That translates to you're a good doctor, and whatever procedure you did it well. That made my entire day. Hearing it from your friends, your relatives is not that much as it is hearing from your patients whom you have treated. I will probably never see that man again in my life, but the words which he said to me as a young intern posted in GMC Nagpur will be forever with me. Another instance when you get the real doctor wali feeling is when you are actually doing a night shift. During the entirety of your MBBS, the only time when you are awake during the night is before an examination when you are studying. I have done that quite a lot of times. Or when you are out with friends. As a doctor, 90% of the times when you will be awake in the night is because you are posted in some sort of night duty where you have to stay awake the entire night. So in GMC Nagpur, we as interns have decided the night duty to be roughly of 12 hours, 8 PM raat se 8 AM subah tak. I actually made a great vlog about it, so check it out after that video is done. In the night duty, there are times when you have a lot of things to do, and there are times when you don't have a lot of things to do. What I personally like to do in the times where it is off and I know that I have to stay awake anyways, instead of scrolling mindlessly on Instagram, taking content which I'll forget in just 2 seconds, listen to amazing audiobooks on Audible. During my last night duty, I listened to this audiobook called as Atomic Habits by James Clear, which talks about how small improvements in your daily life will lead to a big change at the end. It's sort of compounding over time. Something like sitting down to meditate for 5 minutes or studying every day as much as time permits you, or just trying to do some exercise for 1 hour. Reading books can be cumbersome and time consuming for some people, such as myself, but audiobooks are something which you can use anytime you want. While you're walking around in the campus where your hands are busy like you're cleaning your room and your mind is completely free. When you're sitting in the bus waiting for your stop to come. You can save my eyes by avoiding scrolling, get stuff done while taking in knowledge by listening to audiobooks. Plus, being productive by listening to them at whatever speed I want. Audible is the platform when it comes to audiobooks, so click the first link in the description to experience Atomic Habits and thousands of other such amazing books on the fantastic platform Audible. Absolutely free for you for the first 2 months. Which brings me to my fourth point is that if you're placed in a good hospital, you will be able to see amazing cases which you probably would not have imagined and you thought they were extremely rare, but in real life they are not. I was in my pediatrics posting during the ward time and we got a little boy who came up to us with difficulties in swallowing and he could not move his upper lips when he was smiling. He also had some sort of weakness while walking, so he could not walk properly, he would lose balance, and that kid was like 3 or 4 year old. Also, there was some sort of pseudohypertrophy which was present in that case. So in the end, we did a lot of investigations and we finally confirmed that this is a case of facioscapulohumeral muscular dystrophy. So it is a case that I studied back in medicine, I think like June, July of last year, and being able to see that case in real life just, hammered that disease into my brain. Another time we were just in the OPD and there was this girl who came to us. She was a 12-year-old girl and she was unable to walk because she had absolutely no balance. And we were all surprised, and then we saw her file. In that file, it was mentioned that she had something called as Charcot-Marie-Tooth disease, and in this disease your posterior column of the spinal cord, the part of the spinal cord which actually transmits the position, the exact angulation, the degree and the movement of your joints to your brain is damaged. It's progressively degenerating. So all the sensations that you get from the different joints, the positions, they are all gone. So you will be definitely not be able to balance your body because your mind does not know where the position of the joint is. So she had type 1 of the disease and it was pretty severe. Definitely we cannot do anything for her, but being able to see that case gave me a feeling कि ये सब चीजें books के बाहर भी exist करती है. Another patient we got was of head injury, again in the trauma patient only. Road traffic accident was there was a head injury. The patient lost consciousness but then woke up, everything was fine. Then lost consciousness again. He came to us and we took the history from the relative, and exactly we thought that it was a lucid interval due to something called as extradural hematoma. And yes, definitely on the NCCT scan we were able to notify that there was actually an EDH present and he was taken up for surgery, and the surgery was successful. The thing is, like, when you see interesting cases, it just makes your entire day. You ask any doctor, they will tell you this. Interesting cases are going to make you very, very happy. Especially if you are able to clinch the diagnosis on just the basis of the history and the examination. Coming to my next point. As a doctor, you actually understand what the value of a single life is. Like I told you, after giving the CPR, the patient's heart spontaneously started. But there was cases when I was giving the CPR, but the heart did not start. Gave it for 5 minutes, for 10 minutes, but still nothing happened. Because the patient had sustained such severe injuries that it was not possible for the patient to survive. The case that actually told me the reality of how fragile life is was the case of a 32-year-old man who was brought to our casualty by the relatives, who suffered a road traffic accident while he was going back home from a posting which he was in. Just 5 days before he met with the accident, his wife delivered a beautiful baby girl and he had never seen her. He was actually returning home, but in that excitement of going back home, he drove his two-wheeler quite fast, and while driving his two-wheelers, he hit a pig, he fell down, injured his head, got blunt trauma to chest and abdomen, and landed with so many different complications in our casualty. The injuries were so severe that I'm pretty sure that that patient will not survive, and even if he does, there will be so many different comorbidities that he has to live with. So he was just going back home from his duty to meet his newborn daughter, and it is a very real possibility that his daughter will never get to see the father ever in her entire life. The happiest week of their family's life was completely ruined and now will be remembered forever as the saddest week of their life. Where the daughter lost a father, the wife lost a husband. Yes, this is how fragile life is. You never really know what is going to happen the next moment. So please cherish every single moment that you're alive, because the person who is blessed with health has thousands of different wishes, but the person who is not blessed with health only has one. I know that it was very difficult for you to hear, but I'm not going to be that person who just tells you the butterflies and the rainbows and all of that. I'll be the one that shows you the actual reality of what it's like to be a doctor, which I don't think anybody has the guts to say these days. So if you're new here watching me for the first time, or you've watched one of our videos and you liked it, do subscribe to the channel. It would mean a lot to me, and I promise you I won't waste a single minute of your life. Which brings me to my next point, is making amazing friendships with different people around you. There are times during the night duty when you're hungry and your junior resident just orders something for you because he saw you hungry. Then you all sit down and have an amazing sort of after dinner or a snack. So while you're doing your internship, you meet so many amazing doctors and nurses and brothers, and together you form this amazing community of people who are like-minded. You are exposed to different types of specializations such as, say, orthopedics, radiology, pediatrics, all of that. So you get to decide on what do you actually want in the future. You see the lives of different residents and doctors who are posted there, and actually you can take a guess on whether or not you like that field. Moving to the part 2 of the video, that is the bad side of being a doctor. I think most of you people are interested to know what the bad and the ugly side are more than what the good side is. First thing that I would like to say is the time crunch. I don't know if it's the same in different fields, but I know for a fact that doctors have to work a lot, right from junior resident ones to interns to nurses to brothers to everybody who is present in the hospital. We all work as a system to provide healthcare. and it is not something which we can take a leave from. Even when you have to take a leave, you have to provide a replacement because the system can't function without you. Ever since my internship started, I haven't had a single Sunday off, I haven't had a single holiday off. Every time I was posted everywhere. So even today in the evening I have to go at 8 because it's my night duty. Yesterday I came back at around 10:30 from my evening shift. So even if it's like an 8-hour duty, 1 hour before going to the duty, 1 hour after coming back, you can't really work. So it becomes like a 10 to 12 hour shift every day. That just leaves you with 12 hours, and out of it, if you're going to sleep for 6 or 7 hours, you just have 4 or 5 hours for yourself. If you're especially in a boring posting, the most of the time of the day, you are actually wishing to get those 4-5 hours for yourself. The worst part is that the residents don't even get that. I'll get to residency in a minute. It causes a lot of negative emotions and the feeling of burnout very, very fast. So yes, time crunch is the biggest problem, I would say, the bad part of medicine. And there are no fixed working hours because you can work like 24-hour duty for 3 months if that is your posting. Point number 2 is the study and the stress. Studies and stress is a very real thing for the people who are very serious for competitive examinations such as NEET, PG or NEXT or NICT. For me, I have to literally convince my mind, motivate it a lot just to sit down for 45 minutes or 1 hour and study. In final year, I had literally no inertia of taking my textbook and sitting down to study. But over here, when my internship is going on, it's really, really difficult. That causes a lot of stress. When you are not studying, you feel like you should be studying. When you're internship, you feel like you should be studying. And when you actually study and you don't get enough marks in your grand test or in your mini test or whatever, you feel like, is it even worth doing all of this, taking all of this stress and actually giving NEET PG in the first place? Last point with respect to the bad part of the medicine is in the initial years, the payment is extremely low. So now that I've really talked to junior residents and asked them in detail about how you are spending your money, how are you investing in all of that, I've come to the conclusion that even if you're earning like 75,000, 80,000 during residency, it will be gone very, very soon because of so many kharche that you have to do on a day-to-day basis, right? From ordering food to giving parties to your interns, buying different things. And you really feel the absence of money if you are a married person during your residency. So a lot of our junior residents, JR2s, JR3s, even JR1s, they are married. So especially if you're a man and you're paying the rent of your house and let's say for the education of your wife and all of that, it's going to cost you a lot and you won't be left with a lot to save. Financially, it does become a bit burdening, especially if you have to take care of somebody else as well. Coming to this marriage and all of these things, I don't think many people talk about how difficult it is to lead a normal, happy married life once you are in residency. Especially if you have kids and you have to look after them, plus do your hospital, plus do your studies for your MD or MS exams. It is almost impossible, and I have huge respect for the people who do it because I have seen residents do it myself. If you imagine some different fields such as business or management or arts or whatever, it's very normal for people to get married in 24, 25, 26. I've seen couples who have got married as young as 21 and they own a BMW car. So it's not like ki koi bhi aise kar raha hai. Even the richest people of India are doing that. As a doctor, if you are completing your MBBS at 24, 3 years of residency, by 27, you are just starting out as a doctor. This especially very much applies to females, not as much to males because for obvious reasons. I think that was all I had to say for the bad part, and now comes the ugly part. The part which is very difficult to, record without it being taken very sensitively by a lot of people, but I'll try my best. The first point is residency itself. Residency, I think, is the toughest part of becoming a doctor. I'm just an intern, but I'm constantly surrounded by JR1s because I'm the intern who is posted under them. And by seeing their lives, how 24 hours they are working, how less sleep they get, and how they are treated by their seniors, that is really, really frightening. मतलब तुम इतना पढ़ो, नीट पीच में अच्छा रैंक लाओ, अच्छा कॉलेज लो, एंड देन कॉलेज में आके क्या तुम 24 आवर्स सिर्फ काम कर रहे हो फॉर एटलीस्ट 1 or 2 years. I think in our ICU, if you work for 36 hours, you are given a leave for 8 hours. So continuously, if you are there morning, evening, night for 36 hours, that is almost 3 days, then you can probably have a good 6 hours of sleep and then come back to duty again. I was out with one of my residents this week, and she actually told me that in the last 7 months she has gone out to dinner only 3 times. Me as an intern has gone out to dinner like 5 times within the last 2 weeks itself. मतलब काम ही इतना होता है कि you can't think of anything else. But the thing is, after your residency is over, you get to become that specialist. And once you're out in the real world, you can do whatever you want with it. Life is very difficult and very dangerous, but after that, it definitely improves a lot. Especially once you become JR3, SR, and after that, if you pass out and start your own setup, it improves quite a lot. The residency phase, it's very, very hectic. The second part is experiencing deaths. The second week of my internship, I was posted in the NICU, that is the Neonatal Intensive Care Unit, and we have got babies over there who are less than 28 days of life. When you are you're around kids, I used to get attached to a lot of them. I used to go and play around with them whenever I got the chance, and it was a really great time. Some of them were extremely low birth weight with less than 1.1 kg weight, 850 grams. I even saw a child with 650 grams of weight. So what happens? Obviously, it's nature, it's life. It's going to end if it's not compatible. That's the way it has been for centuries. That's how natural selection works. The fittest survive, and that's what actually happens. Once you get too attached and then some sort of death happens, is with your mind. You get depressed. You think about the family who experienced that. Since you are affected so much, imagine how the mother will feel, how the patients will feel. And I think everybody who has been in an ICU posting always complains the fact that once a death happens over there, can't really stop thinking about it. Which brings me to the last and the final point of this video, is that experiencing a lot of that kind of numbs you. The problematic things for the people outside your hospital becomes very normal for you. Maybe your friend is telling you that their mother fell down the stairs and they broke their femur. You'll be like, अच्छा तो क्या अभी hospital में treatment शुरू है? Instead of having a normal response like, oh my god, क्या हुआ, कैसे है? So that's how numbing works. And once you experience a lot of that, practically you won't be affected by anything else. So your brain kind of goes emotionless. This is much more seen in doctors who are experiencing deaths more than others, such as oncology, which is a branch of cancer, where if you're diagnosed with cancer, we all know what happens. So yes, I think that covers it. I really wanted to put this video out there for all of the young and budding doctors and future doctors over there who could probably look into this video and imagine what their future life is going to be like. So yes, thank you very much for watching. If you found this useful, please make sure to hit the like button and also check out Audible using the first link in the description. Thank you for sponsoring. It's your boy Dr. Anuj Pachhel bringing you the truths of medical life here on my channel. Make sure to subscribe. I'll see you next time. Goodbye.